For the neck, you pre-treat the area with some heat or some ultrasound, or if you don't have either, you really don't need to. You can get by without it. Put some grease on the neck or massage cream. You want to use the tool with the beveled edge, this edge up, away from the patient. I like to hold it in my hand like this. You can use two hands, whatever's comfortable for you, and about a 30-degree angle to the patient, to the surface area treated. Imagine 90 degrees, 45 is about in the middle, 30 degrees is just a little less than that. Close enough is good enough. Okay, keep it simple. Have the patient just flex their head a little bit away so that the muscles, paraspinal muscles between the spinous process and transverse process stick out a little bit. Run the tool up very lightly a couple times. See what you feel. And then rub the tool down very lightly a couple times. Whichever one you feel the most roughness or grittiness or resistance, that's the direction of treatment. If you really can't tell, just treat it inferior to superior if you feel comfortable doing that, or you can treat the other way if you like. Then gently, and you'll have to learn how much pressure to use from experience and of course patient tolerance. Then you want to start the treatment with slow and steady strokes, and you treat for about 1.5 minutes to 2 minutes, or until you get a large red massive petechia reaction, which right away we're already starting to get here. And again, I find that the people that have these huge red reactions relatively easy get the best symptomatic relief. It looks horrible, but they feel great. Now, right about that degree of red, I would say that's good enough. If you have somebody who's larger, you can use the straight edge of the tool for them. Somebody who is very sensitive, you can use the concave area, and that'll spread the force out a little bit more so it's not quite as strong. It'll work just as well. If you find one area that you want to focus on, use the small convex area, and you can focus in on it. After the treatment, give them just a nice gentle stretch. Wipe the grease off. You can use ice afterwards if you want, because it is actually a type of injury to the tissue. Otherwise, just wipe it off and they're good to go.